Next, a story about a miracle-working eye hospital in India. About 45 million people in India suffer from some form of visual impairment. 10 million are blind. Of these, 2 million are children. Doctors say sight could be restored to many, and that almost all the blindness is easily prevented. Fred de Sam Lazaro of public station KTCA, Minneapolis-St. Paul, visited the Aravind Eye Hospital in Madurai, India, and prepared this report.
The city of Madurai, deep in South India, is best known for its spectacular Hindu temples. Built several hundred years ago, they still attract thousands of worshippers. But in recent years, Madurai has been attracting thousands of new visitors. These are not sightseers, rather they are people seeking to have their sight restored. It seems unlikely that an old city which still has manual stoplights would draw pilgrims of modern medicine. But Madurai has what many experts consider one of the finest eye hospitals in the world. This is one of several operating rooms at the Aravind Eye Hospital in Madurai. Almost 150,000 surgical procedures have been performed here since the hospital opened in 1976, performed by some of the most qualified ophthalmologists in India. They work with the most modern laser and microscopic technology in the world. Dr. G. Nachiyar is Aravind's chief surgeon. She says India's blindness problem spares no age group. It begins in early childhood, a direct result, she says, of malnutrition. Ironically, India has enjoyed agricultural surpluses for the past several years. Nachiyar says there haven't been similar improvements in food distribution and education.
I really feel strongly that malnutrition blindness is not due to poverty, it's not due to starvation, or is not due to lack of food, but is due to lack of knowledge in giving a balanced food.
Because their mothers must return to the labor force soon after giving birth, Nachiyar says many Indian infants are left in the care of older siblings. Breastfeeding is irregular, and babies are often fed the same diet as adult family members.
They don't realize that a child aged about 8 months or 1 year needs a different calories or different type of food than an adult of 20. We just tell them how greens or carrots or cabbage or cucumber or a papaya can improve a child's health without any medicines.
Among adults, Nachiyar says the most common cause of blindness is cataract formation. Unlike the developed world, where the onset is in the 6th or 7th decade, cataract strikes people in India in their 50s, even mid-40s. Here, it also blinds most of its victims because it is rarely treated.
The causes are not still very clear, but one, they say it's tropical. Two, they say still the Indians have got a genetic tendency for early cataract. Then actually the population is more, the incidence of cataract is more.
There is nothing which disables a man like cataract and poor eyesight. And there's nothing more easier than to mend it. You just do a small operation and give him glasses, you make the man a whole man.
71-year-old Govindappa Venkatswamy founded the Aravind Eye Hospital in 1976. Despite severe arthritis, which crippled him as a young man, Venkatswamy went on to become one of India's best-known ophthalmologists. The sophisticated facilities helped establish Aravind as a leading center for eye care and research. But more important, the revenues from paying patients helped bankroll a 350-bed free clinic. Today, 2/3 of all surgery at Aravind is performed here. Not surprising, since most blind people in India are too poor to afford care.
Right now they are coming to us, maybe 6 months or 1 year later, after they have ceased to do their job. And that's the big time for them, because you can imagine how a man who is a daily laborer, if he is not having his wages for 6 months, it is difficult for him to support himself. So we need to set up a powerful marketing system, social marketing system, to get more and more patients, if possible early, before they start losing their earnings.
Social marketing is a term heard commonly among healthcare professionals here. The Aravind Hospital's chief means of social marketing or recruiting patients is through eye camps. bringing Aravind to its rural patients instead of the other way around. The location for this recent camp was a school building in a small town about 50 miles outside Madurai. With Aravind's growing reputation for healing and posters announcing the camp weeks in advance, there was no shortage of patients. For them, the camp was a familiar, less intimidating environment than a distant hospital. Camps are usually held on Sunday. That increases turnout since a younger member of the household is free to bring the patient in. On this day, between 7 and 11 a.m., about 350 people had their eyes examined.
What's his best vision now? 6'6". Okay, very good.
Jordan Cassello is an optometrist from upstate New York. He's one of dozens of international scientists and ophthalmology students who visit the Aravind Hospital each year to learn, teach, or do research.
I felt this eye camp was run beautifully. It was efficient in that the doctor saw the patient first and determined what tests needed to be done and was able to channel the person into the right direction for those tests to be done. And as soon as a pathology was picked up by the doctor, he could channel the patient properly so that a minimal amount of tests could be done so that they could be sent to the hospital if needed, or get a pair of glasses if needed, or just have a routine eye exam if needed.
About 100 patients at this camp were found requiring surgery, most for cataracts. As part of its international program to assist the blind, the Lions Club, through local chapters, furnished immediate transportation to the hospital. By 8 o'clock the following morning, more than 20 patients from the previous day's camp had already been through surgery. By 11, all had settled into a couple of days of post-op recovery, room, board, and transportation back home on the house.
It's a real giving group of doctors that I've seen. They work 6 to 7 days a week, 10 to 12 hours each day, and they seem to do it with joy, and they seem to do it out of the goodness of their heart, and they are not as concerned with the economics of their profession.
Although surgeons at Aravind live comfortably by Indian standards, their earnings are only a fraction of what they could be in private practice, especially if they move to Europe or the United States. Yet Nachiar, trained in surgery at the University of Illinois and Harvard, says restoring sight to thousands of blind people is plenty of reward.
I wish if I'm an artist, I could draw that smile when you put the glasses onto them. And that innocent smile, and they think that you're next to God. That feeling makes us sort of, very rewarding, and I feel this is much more than being wealthy individually or personally.
Beyond eyesight, Aravind restores considerable human productivity in communities it serves. People who were burdens can now resume normal activities. In India's extended family system, sociologists say just being able to care for grandchildren can do much for harmony in the household. Without question, the most rewarding patient for doctors here is 1-year-old Zulfikar Ali. He's been blind since birth?
That's right. One of the eyes is more blind than the other eye.
I see. What was the reason for that?
It's a congenital cataract.
Congenital cataract?
That's right.
How much of his vision will you restore?
Because he's very small, he's only 1.5 years old. Maybe almost complete vision we can restore.
He'll return to normal vision.
The main problem in India is they come very late, where we can't do anything. Even if we operate, they won't get the vision.
Despite a sea of reward, doctors here say there is an ocean of frustration. When he heals in a few days, Zulfikar Ali will join only a small minority of India's blind who've received timely eye care. Aravind's prolific numbers and government eye care programs over the years have barely put a dent in India's blind population. Dr. Venkatswamy says he'd like to see Aravind expand to other parts of the country. While there are plenty of available doctors, Venkatswamy says India lacks people with organizational and administrative skills who can combine the various disciplines into an efficient assembly line operation.
In America, you have models where it is Sears stores or MacNeil hamburger, or you are able to open a chain of shops or restaurants or hotels, and you are able to organize them efficiently. In India, we haven't got a model like that one.
To help train good managers, leaders like Dr. Venkatswamy, Aravind next year will institute a hospital administration program. The curriculum will be set up with help from the University of Michigan, appropriately not far from where the assembly line idea was born. Venkatswamy's peers say he has done for ophthalmology what Henry Ford did for the automobile.